Hi, everyone. I'm Larry Castellino, Chief of the Division of Health Policy and Economics in the Department of Healthcare Policy and Research at Weill Cornell Medicine. At present, my research focuses on the organization of the U.S. healthcare delivery system, relationships between the delivery system and payers, such as health insurers and Medicare, payment methods, and processes to improve quality and control costs in healthcare. I'm currently engaged in projects on joint physician-hospital leadership of hospitals and healthcare systems, on the use of so-called teamlets in primary care, on the relationship of the prices paid to physicians with the cost and quality of the care they provide, on the new phenomenon of private equity acquisitions of physician practices, and on measuring physician altruism and its relationship to the quality of care for patients and cost of care for patients, especially for socioeconomically disadvantaged patients and patients with multiple chronic diseases. I direct the Physicians Foundation Center for the Study of Physician Practice and Leadership at Weill Cornell. A generous 5-year grant from the foundation makes it possible for us to conduct the research projects that interest us immediately without going through a lengthy grant application and review process for each project. Our goal is to help create conditions that enable physicians and the organizations within which they work to improve the health of individual patients and as a population while helping to constrain the growth of healthcare costs. We pursue this goal by conducting and disseminating empirical research and by writing conceptual articles aimed at clarifying key issues and informing public policies, as well as the private policies created by healthcare organizations.
Hi, I'm Mark Unruh. I'm an assistant professor and also the director of certificate programs in the Department of Healthcare Policy and Research at Weill Cornell Medical College. I also serve as the director of data and methods for the newly formed Center for the Study of Physician Practice and Leadership. My research primarily focuses on the ways in which state and federal policies influence the behavior of healthcare providers and the resulting impact on the quality and cost of care. This includes studies of provider response to changes in Medicare and Medicaid payment methodologies, and also the impact of incentives for provider adoption and use of health information technology on outcomes of Medicare beneficiaries.
Hi, my name is Amelia Bond, and I am a health economist in Weill Cornell's Healthcare Policy and Research Department. My research focuses on provider incentives and has 3 core areas. First, innovation payment systems primarily surrounding physicians and physician groups. Second, the organization of hospitals and physicians within a market. And third, more general and fundamental questions surrounding physician practice patterns. In the first area, innovative payment systems, I have 2 types of ongoing projects. One set of projects are randomized controlled trials within a health system or payer, where our research team actually alters or completely redesigns provider payment systems and then evaluates its impact on quality and cost. One specific project currently underway is with Blue Cross Blue Shield of Hawaii. Our team constructed a population-based per member per month based payment with risk, quality, and total spending adjustments. This new payment structure fully replaced the previous fee-for-service system. We are in the first year of evaluating the impact of the new payment system on quality and total spending. The second set of projects in the innovative payment system research area is just beginning and uses more traditional observational analysis with large Medicare databases. I'm particularly interested in how independent and/or small practices survive in the rapidly changing payment environment. In the second area, the organization of hospitals and physicians within a market, I am interested in understanding whether certain types of hospital or physician organizations provide higher quality and/or lower cost care. For example, physicians are increasingly becoming employed by hospitals. I want to know whether this relationship improves care coordination and improves quality, or simply increases the total cost of care due to increased bargaining leverage over insurers. In the third area, physician practice patterns, I'm interested in understanding why so much variation exists across physicians and what drives these differences. In one project using military health data, we will be able to track physicians over a decade and across multiple geographic moves. This allows us to determine whether physician practice patterns evolve over time, or evolve due to different patient populations, or evolve due to a host of other factors.
Hi, everyone. My name is Yuhua Bao. I'm an associate professor in healthcare policy and research. I have a secondary appointment in psychiatry. A general question I ask in my research is, how do we design policies in a way so that incentives are aligned to meet the enormous needs of patients with mental health and substance use conditions? A prominent example of such policies are payment to providers. A current focus of my research is concerned with state policies surrounding the prescription drug monitoring programs, or known as PDMPs. PDMPs are important tools in states' policy toolkit to address the opioid crisis. The idea is to give prescribers a complete picture of a patient's history of opioid prescriptions so that prescribers can identify patients at high risk of misusing opioids, while ensuring that patients with low risk and legitimate use have their pain effectively controlled. We have conducted a series of studies over the past few years to examine state policies surrounding PDMPs and whether these policies have achieved their intended effects, such as changing prescribing behaviors, mitigating patterns of prescription opioid use that put patients at high risk of misuse and overdose, and reducing opioid-related emergency department visits and hospital admissions. We have recently started to examine potential unintended consequences of these policies, such as abrupt discontinuation of opioid use, regardless of patient risk or harm.
Hello, everyone. My name is Jing Li, and I am another assistant professor in health policy and economics. My research is centered around two larger themes. First, I am interested in specific mechanisms that affect important decision-making of physicians and patients or consumers in healthcare, and the resulting impact both on patient health as well as efficiency and equity of the delivery system. For physicians, these include preferences and incentives that make them more prone to certain behavior or practice patterns. For patients or consumers, these additionally include socioeconomic background and cognitive abilities for navigating complex decision-making. The second theme of my research is applying rigorous and innovative quantitative methods to address relevant questions and uncover important relationships in health and healthcare, broadly speaking. As an example that illustrates both of these two themes, a major line of my ongoing work uses experimental economic methods to measure altruism of medical students and physicians, and uses altruism to predict important decision outcomes, including career choice and quality of care. Additionally, several of my current research projects focus on issues in aging, especially those surrounding patients with Alzheimer's and related dementia who suffer from cognitive impairment that affect their ability to make important healthcare decisions, such as those regarding end-of-life care and the related issues on advanced care directives.
Hi, everyone. My name is Dhruv Kular, and I'm a physician at New York Presbyterian and an assistant professor in the Department of Healthcare Policy and Research. My work focuses on several areas, including physician and organizational incentives, caring more effectively for high-need, high-cost patients, and designing and implementing telemedicine technologies to improve access to and the quality of care. I'm also a regular contributor to the New York Times, where I explore various aspects of medicine, health policy, and economics. In my work at HPR, I also serve as the Director of Policy Dissemination at the Physicians Foundation Center for Physician Practice and Leadership. In this capacity, I develop strategies to effectively communicate about our work to patients, physicians, and policymakers, and work with other faculty members to disseminate their findings. My aim is to use data and narrative to communicate critical issues in medicine and healthcare in a compelling way to a broad set of stakeholders and audiences.